Welcome to Learning to Glow, a show about wellness, skin health, and self-development. I'm your host, Jess. I'm a mom, entrepreneur, and skincare expert. I'm so excited to share tips on how to achieve healthy skin and bring amazing guests in the field of health, fitness, aging gracefully, and personal growth. Let's explore all different ways we can take care of ourselves as women, both inside and out, to truly shine. So let's get glowing. Hello, everyone, and welcome to Learning to Glow podcast. Thank you so much for being here with me today. We are diving into a completely new topic on this show, and I am so excited to share this with you. It's dental sleep medicine, and I'm joined by Dr. Shereen Lim, dentist and author of Breathe, Sleep, Thrive, to explore how our jaws, airway, and breathing patterns shape our sleep and our overall well-being. I actually am reading this book right now. It is so good. We talk about the book in this episode as well, but if you are listening to this and you can relate to any of it, make sure you get the book because there's so much information. Also, if you have young kids, there's a lot of things that she talks about that we need to be paying attention to. So we talk about mouth breathing, early signs of airway issues in kids, and tools like myofunctional therapy that can make a huge difference. I asked about mouth tape, which I've talked about on the podcast before, for adults, and we get into so much more in this episode. I am so excited for you to hear it. So this conversation is just great. It's very eye-opening, and let's just say that I've had some personal experience with some of the things that we're talking about, and I just think it's so important for anyone wanting better sleep for themselves and their family to take a listen. So we are also in holiday mode over here. So if you are looking for a great holiday gift this season, our two most popular sellers over the past month with Simply Just Skincare have been our new glass skin kit and our Reboot restorative oil. These are so great for this time of year too, with the drier season, and the little mini repair toners make such a great stocking stuffer. I just brought those back into the line. They were not available before, but they are great for travel. You can keep them in your purse or whatever you take, just, like a great to-go item. So use code podcast on our site when you're checking out for the coupon code to receive 20% off. It's at simplyjustskincare.com. And if you have any questions, let us know. Now, enjoy this episode, and I hope you love it as much as I did. Hello, everyone, and welcome to our show today. We have Dr. Shereen Lim, and we are so excited to talk to you, something we've never talked about on this podcast before. I have your book right here. You are an author, and Breathe, Sleep, Thrive. And before we get into this topic today, which I'm so excited about, we chatted a little bit offline. Please introduce yourself and tell us what you do.
Yeah, I'm a general dentist from Perth in Western Australia. I've been a dentist for over 25 years. And I first got involved in snoring and obstructive sleep apnea because of my husband's snoring. So about 14 years ago, it was driving me pretty crazy. And I decided to get up in the middle of the night, start Googling or researching dental sleep appliances. I was aware that these could help people sleep better and quieter night's sleep. And I decided I was going to help other spouses in the same boat, being so frustrating. And so that's when I became one of Australia's first dentists to qualify with a graduate diploma in dental sleep medicine. And I became involved in addressing adult snoring and obstructive sleep apnea with dental devices that reposition the lower jaw forward. And I always wondered, snoring and obstructive sleep apnea, it affects people's quality of life. How come we are managing this jaw problem and not growing jaws better in the first place during early childhood? And so that's how I became involved in early interceptive orthodontics and really trying to address or understand the oral dysfunction. So if we understand form follows function, how the jaw structures grow in the earliest years of life is influenced by how the muscles of the face and mouth are working. If we can get those working correct, we can actually promote good jaw development in those early years of life, and that will help develop good airways and airway health.
It's so interesting. And I was just telling you, there's so many things and layers to what you do. And I've talked, your story is so common with the husband who's snoring and the wife who's like, I can't take this, or I'm going to sleep in another bedroom down the hall because I can't take it. But there's real there's health issues when you have these problems, and then you're saying, we can do so much by starting earlier in
Mm-hmm.
childhood and like looking for signs, and I want to get into that. But you talked about dental sleep medicine. So I had never even knew that was a thing. So can you just tell us a little bit, like what does that mean, and is this a common thing? I've never heard of a dentist that offers this.
Oh yeah, it's reasonably common. Dental appliances, they're often called mandibular advancement devices or mandibular advancement splints. They're well proven to be one of the frontline options to address snoring and obstructive sleep apnea. So
Okay.
it's really about there's an upper and lower piece that you wear overnight during sleep, and so it brings the lower jaw forward. And what this does is it opens up the airway. It brings that base of the tongue forward and just stretches open the walls of the throat. And yeah, so that's what's involved. And it's been around, it's a frontline treatment for people that have mild to moderate obstructive sleep apnea, or even people with severe sleep apnea who do not tolerate the CPAP, which is the pressure mask.
Yeah.
It delivers, high pressure air to keep the throat open during sleep. So a lot of people can't tolerate that, even though that is the most effective option. So the mandibular advancement devices are, an alternative for that as well. But the thing is, that was then. Now, dentists have a much more recognized role in improving airway health through other interventions, such as palate expansion, not just for children, but also for adults. It can actually help to alleviate obstructive sleep apnea, and also jaw advancement surgeries. Surgeries that can bring the upper and lower jaws forward. They're actually really effective if people have got jaws that are more recessed. And even things like looking at myofunctional therapy, which is tongue and throat exercises. As a dentist or oral physician, we have an important role to recognize early warning signs inside the mouth, but also in all these various interventions. And by having that full spectrum of options, the dentist plays a really important role. So dental sleep medicine has evolved to not just include those lower jaw repositioning devices, but these other expansion, myofunctional therapy, addressing tongue ties and jaw surgeries.
Okay, great. So if you have an adult, I want to start with the adults and then I want to get to the children because, there's so much you said we could do preventatively and, seeing things early and early intervention and things like that. But say you have an adult and they are having some sleep apnea issues. Is that just considered like the snoring, or what are some of the other signs that you have sleep apnea or you will have it in the future?
Yeah, I mean, obstructive sleep apnea in adults, uh, it cannot be diagnosed without a sleep study.
Okay.
And so 85%, it's estimated that 85% of adults with obstructive sleep apnea have not even been diagnosed.
Mm.
And so in an adult, it's really defined as having 5 or more apneas per hour of sleep. So an average of 5 or more apneas, which means a 10-second partial or complete obstruction of the airway, despite efforts to breathe. So there's an obstruction in the airway. So it has to reach a 10-second threshold, and it has to happen 5 times per hour. So it's very arbitrary, but really snoring is one of the first signs, gasping during sleep. But a lot of people can have obstructive sleep apnea without any real symptoms.
Wow.
Yeah, things like just unexplained awakenings, waking up quite or frequent need to go to the toilet during the middle of the night, um, you know, waking up feeling unrefreshed. A lot of it plays out with people's energy levels, their mood. There are links to obstructive sleep apnea and depressive symptoms, and even research that has shown treating obstructive sleep apnea, for example, with CPAP can actually reduce depressive symptoms. And really, it is linked to an increased risk of virtually every chronic inflammatory disease, from cancer, heart disease, strokes, diabetes, uh, all these health conditions where there is increased inflammation. So we need to pay attention to how well we are sleeping And not just that, but the breathing during sleep as well.
I mean, you hear all the, oh, sorry, go ahead. Go ahead.
Yeah, I think really we want to recognize that, when we're looking for obstructive sleep apnea, that's really the tip of the iceberg and it's really the end stage problem. But adult obstructive sleep apnea doesn't suddenly happen when you put on weight, or it's a developmental problem that begins from infancy through how the jaw structures are growing and how the tongue and muscles of the airway are working.
Okay, that's so interesting. And I know sleep is so important. So when you're not getting that quality of sleep because you're dealing with like you're having trouble breathing, really. And then this is going to affect like so many different other areas of our life. But I wonder for someone who's like, I'm going to use me because one thing that was so interesting about this and something that I've been learning more and more about is people talk about nasal breathing versus mouth breathing.
Mm-hmm.
And I have always slept with my mouth open. I've always been a mouth breather. So I don't snore, but I sleep with my mouth open. And, and I do have a lot of times where I am awake during the night, or I will wake up and be like, I was in bed at 8:30 and I'm sleeping till 6 and yet I'm still tired. So I could see that maybe there's something there. And is that also maybe a symptom of not being able to fully breathe through your nose and having to use your mouth? And is mouth breathing a big red flag, or are there a lot of repercussions from that?
Yeah. So really, I guess obstructive sleep apnea is the end stage or in the spectrum of disturbed breathing. And snoring is somewhere early on. It's one of those early markers, but really mouth breathing is the first sign that things are going off track. We are designed to breathe through our nose with our mouth closed as well. And really, when we breathe through our nose, it actually is designed to warm, filter, and humidify the air. And we actually have nitric oxide from the paranasal sinuses. And when that gets, when air goes through our nose, we get that nitric oxide, which is really great. It's antimicrobial and it actually promotes better oxygen exchange as well. And so we want to use our nose. And when we open our mouth, it's just more low, floppy muscle tone. And when we open our mouth, we're going to be more prone to snoring. So if you try snoring with your mouth open and closed, it's easier with your mouth open. Yeah, and this is when we're going to get more interruptions in airflow. It's not going to be as smooth. And then this is when we're going to get more sleep fragmentation, or the quality is not going to be as good. Okay. So we even know, for instance, in children, there's research to support mouth breathing alone can be linked to increased risk of symptoms of ADHD in children. So, but why is it really important to pay particular note in childhood? It's because the facial structures are growing so rapidly. 60% of the adult-sized face is attained by the age of 6 years. And when we have mouth breathing, it promotes low muscle tone. The jaws are open and the chin and lower jaw is swinging backwards. So instead of forward and wide development of the face, are we going to get that more recessed or longer face with the narrow palates? And that type of configuration of jaw structure is associated with narrowed airways, narrowed nasal floor, reduced tongue space, pinched airways, because the more forward the face, the more space for the throat, the more recessed the jaws, everything is more crunched and smaller and narrower, more collapsible. And so therefore, we want to pay attention to this in early childhood because that actually can set up good airway development if we can get good nasal breathing with the mouth closed. So a lot of people will say, is it okay to breathe through your nose and have the mouth open? We want the mouth closed. And ideally, we want the tongue lightly suctioned to the roof of the mouth.
That is a big red flag then. So do you, and I don't know if this is, because I want to ask you, like, what can we do about all this, a little bit, but I know that mouth tape is a really hot thing right now. And is that a Band-Aid, or like, is that something that you are all in for?
Yeah, in a way it is a Band-Aid because ideally we just want the tongue to rest up, lightly suction to the roof of the mouth. And if that is occurring, it's actually impossible to mouth breathe. We have the good tone, the lips will close more easily. And that's something that can be trained, particularly in children. And first of all, we need to make sure that people can breathe through their nose. So just making sure that people can breathe through their nose. We got to address any anatomical risk factors, whether it's obstructions inside the nose and throat, or whether it's a poor jaw structure, which is linked to narrow nasal passage if we have a high arch palate. So if the top jaw is underdeveloped, we will have some sort of limitation in our nasal airflow, and things like allergies as well. But the thing is, in children, you wouldn't necessarily tell them to tape their mouth unless there was a specific advice from a healthcare professional. But for some adults, it becomes more difficult to address, for instance, a lot of the palate structure, and it's harder to rewind some of those dysfunctions in an adult. So it could be quite reasonable for an adult to try mouth taping, because it's not like duct tape. It's porous tape that you can still breathe through if you have to, and can be easily removed. A lot of adults, they do find that their sleep quality improves. And so, it can really help them. I've heard people have less headaches. They just feel fresher. And so I think that, yes, if it can help them, there should be no issue with it. But as a rule of thumb, it's really important to not do this if you cannot breathe through your nose with your lips sealed. It's probably better to get that investigated first.
Right. Oh, that's so interesting. Okay, so I have tried the mouth tape, and there are times when I first started, I would wake up in the middle of the night. I'm like, where did it go? I must have just ripped it off in the middle of the night. And then I remember sometimes it would be wrapped around my finger or on the pillow, or I was like, what was I doing last night? But once I kind of gave it some time, I actually found, I'm like, oh my gosh, I woke up and my mouth tape is still on. And I do think it did help. But then it makes me think, okay, I maybe need to look further into this for my health, because as someone who I have had some fatigue issues in my life, like major ones, especially more recently. And so I'm like, okay, like this is so interesting that this could lead to, like you mentioned so many things, but like the fatigue is rough when you're already approaching perimenopause and, having those fatigue issues. So maybe we could rewind a little bit. When I read, one of the things that I read in your book was with children and in their mouth, and like how sometimes there's teeth crowding. And I wanted to ask you about that and what we can do, and what are some signs that we can look for in our kids so that if we do see some red flags, we can address them.
Yeah, for sure. Really, in dentistry, there's a big shift now, because it's not just about straight teeth. Really, when we have crooked teeth or crowding or orthodontic problems, a lot of it is to do with that jaw development, poor jaw development. The jaws haven't grown properly to allow all the teeth to fit well. And the jaws are important because as much as we can look inside the nose and the throat, those jaw structures form the outer borders of the airway. So really the floor of the nose, the house for the tongue, and the framework or the support for our collapsible upper airway or throat. And so when that doesn't develop well, we will have reduced structures or increased collapsibility and increased risk of airflow limitation. So we don't want to just wait for crowding to keep going and then at age 12 do braces and sometimes take out teeth, because we're not addressing the underlying problem. So for parents, we can recognize if there is any dental crowding to see that this is a jaw problem, it's a airway problem or airflow limitation. Anytime there is an open bite where the teeth don't match, or there's a deep bite where they overlap vertically too much, or there's a cross bite where the jaws don't fit symmetrically or in line, or an underbite or an overbite, they're all problems of jaw structure. So they're all issues that we can develop the jaws well, particularly in the earliest years of life. But if we can recognize that form follows function, and that jaw stimulation, we need good stimulation of our muscles to develop the jaws well. We can, in the earliest years of life, the earliest warning signs that there are going to be problems ahead with jaw development and airway development is oromyofunctional disorders. So these are problems where the muscles of the tongue and the mouth and the throat are not working correctly. So for instance, with breastfeeding problems or feeding problems during infancy, where children aren't getting a good latch, they're actually painful, shallow latch, or they're taking in air. They're not swallowing well. There's a lot of clicking and gulping, and sometimes gets misdiagnosed as reflux. That could be one of our various earliest warning signs. Or introduction of pacifiers, which actually lower the tongue posture and increase sucking forces, which actually can distort the palate. And things like ear infections or difficulty swallowing food, like ear infections repetitively, a lot of the time they're related to poor swallowing, where a child is actually not lifting their tongue properly, their soft palate doesn't lift properly, it doesn't open up the eustachian tubes, and there's a lot of fluid buildup, and the ears don't drain well. So all these issues, speech issues where the tongue is not lifting correctly or working correctly, things like gagging on foods all the time, or aversion to chewy foods, steak, these type of issues, mouth breathing. There's so many of them. They're really our earliest warning signs that our muscles aren't working correctly, and therefore our jaw structures won't work correctly, which is an underdevelopment of our outer borders of our airway.
So, okay, you got me on the chewy food thing. I've been told by somebody in my house that my chicken is too chewy, and I'm like, it is not. But it is something that makes me wonder, and for other parents, I could imagine this could be labeled as like pickiness.
Yes.
As well, because like, oh, they're just picky. They don't like certain things, but then maybe it's a little bit deeper than that. Is that a common thing that you hear too? Oh, they're just picky.
Yeah, they're just picky. Some children just prefer bland white foods. They don't like their mixed sauces, things like that. Or even parents will think, oh, my child has gone vegetarian. I always think, well, let's see if they can chew and swallow properly, whether they may enjoy their meat better.
That is so interesting. Okay. So say you have a child and they're displaying some of the things that you're mentioning, maybe overcrowding, or, maybe they're mouth breathing, or, even just like what we just talked about, like, oh, I don't like chicken or steak because it's too chewy. What's the first step for a parent? Is this something that you talk to your dentist about, or do you need to talk to an occupational therapist? Where do we start when we're seeing, okay, there's some red flags here?
Yeah, usually it's my preference for a patient to see that before they see me, to see someone that is more specialized in oral function. So, for instance, with an infant, to see a lactation consultant, an IBCLC, who has actually got special training in oral function and tongue ties, because they're not all really looking at the same thing. There's still a deficit in training. A lot of people, we're not really connecting the dots super well throughout all our medical and healthcare training. So some lactation consultants, they're really happy if the baby is feeding well, in terms of not having any pain or there's good weight gain. That's good enough. And then some parents will say, but my baby's coming on and off all the time. They're so distressed, they're taking in air, they're arching. It doesn't feel right. There is pain there. So I think you have to find the right lactation consultant, which can be challenging. And I think the thing is for parents to recognize that there is a variation in knowledge. So you do always have to trust your gut. And then, yes, we go on. And I have an OT colleague who actually has training in myofunctional therapy. So as children get older, we want to look for speech and feeding therapists and various therapists that have training in myofunctional therapy, because they're going to be able to recognize when the mouth is not working really well. Because sometimes I'll see children that have gone for speech therapy for years and years, just not getting anywhere. They're not making any progress. But it's a speech pathologist with an interest or training in myofunctional therapy that may be able to recognize, oh, how are the muscles actually working? How mobile is that tongue? How are the jaw structures developing? Or how is that child breathing? These are people that will be more in tune to other issues that could be contributing, like the root issues of any feeding problems or speech problems.
Yeah. Thank you. I think that's really good to know, because I won't say too much, but I have a child who I think has some of these issues, and it's not something that, if you get to, like you said, you're 12 years old, you have all this crowding, and the next step is just the braces, right? And then you've kind of like, the dentist hasn't really addressed any of these things that you're talking about.
Mhm.
And maybe there's like a step missing. And if you are, it's not like it's too late before if you hit 11, 12
Mhm.
to make some progress here, right?
Yeah, it can be very challenging, definitely, because the other day I was talking to a mum and she's like, I've taken my child to an orthodontist every year. Every year they said, oh, it's a little bit early, let's just wait. And then all of a sudden she took a child 1 year and they said, oh, it's too late now. And
Oh
she's
my
said,
gosh.
I've done everything right. I've brought my child every year when you've told me everything was simple, and now my child's 12.
Oh,
I don't do palate expansion for that age group, for instance, because that can help to open up the airway structures. Because there's a mid palate suture, there's a suture in the palate, and it starts fusing around age 9. And when we do normal palate expansion, the way that I would do it for children, it's really easy because that suture in the middle of the palate is pretty easy to separate with whatever device that we use. And that can stimulate bone in the mid palate, which is the floor of the nose. It's harder to do in a 12-year-old because those bones are quite fused. And oftentimes, there are better options that can actually get better nasal remodeling and address nasal obstruction or disturbed breathing. You can use these mini implants, little tiny screws that are placed in the jawbone right close to the suture, so that when you turn a screw to expand or separate the halves of the palate, you can actually get you won't move the teeth so much. You'll be able to get that true separation of the bones. Does that make sense to
yeah.
you?
Yeah,
Yeah.
for sure.
So that is a fairly new innovation, and really in our part of the world, it's really difficult to find a provider who will offer that. But yes, in other parts of the world, if you have an older child or an adult, you can still do these, and these mini implants or little screws, they actually make it more possible to achieve similar outcomes that we would in children. So yes, there's not all hope is lost. It's just that
Right.
it's really difficult to find the providers for that in some places because it's not something that's taught in dental school. It's only been around, for 10 years. It's been more uh, done. But if you don't have that training or exposure, it's very difficult to find a local provider. So it can be very despairing to
Yeah.
know that there's something available. And it just makes me think, why don't we just get in earlier? Why don't we treat earlier when it's more simple?
Yeah. Oh, I'm so glad that we're having this conversation because it's like this is also new to me. And I think probably for a lot of moms. And there's so much attention, I feel like, with a lot of different things in childhood development that we are like, red alert if you see certain signs. But this has never been something I was educated about. And I think it's so important. You mentioned earlier in our conversation that the only way you can get a diagnosis of the apnea is with a sleep study. If you're seeing some of this in children, do you recommend a sleep study, or is that something that's like more for adults, or what is your philosophy on that?
Yeah, I don't generally tend to refer for sleep studies because if we get a sleep study report back, that when you have a sleep study, there's so much information. There's a lot of leads and things that are placed, and it collects a lot of data. But really, often a sleep physician will actually look at the summary and the report, and it may have your child has sleep apnea or it doesn't have sleep apnea, but you can have not have sleep apnea and not meet those arbitrary definitions, but still have all the same symptoms of snoring and mouth breathing. So I think for children, for most of the children that don't have syndromes or regular, otherwise healthy children, I'm more interested in, are they breathing through their nose or not? Yeah. And I listen a lot to what parents have to say. And if I see a risk factor, such as a very narrow palate or just even low muscle tone, open mouth posture, or low tongue posture where the tongue is not sitting correctly and it's sitting low, I'll try to address that risk factor rather than go through this whole process of a sleep study to then get a very summarized version of what's actually happening that may actually make it underscore or underemphasize the problem that a child is having and not take into consideration what the parent is actually saying about their child sleeping. their child could be tossing and turning and just difficult to sleep with 360s and kicking them all night. But that sleep study summary, which is mainly looked at, may not reflect that. So yes, I tend not to, because actually I know with the interventions that I've been doing, we can actually improve the quality of life and the sleep quality. And yeah, we need to do these dental interventions anyway if the mouth is not forming well.
That's really good to know. I mean, that just makes so much sense. It's like the parents are seeing what's going on, and that report is probably more valuable.
And Jess, that is really my approach.
Sure.
There may be other sleep physicians or pulmonologists that don't completely agree with that, but this is just from my practical point of view.
Yeah, that makes total sense. So you talked a little bit about, I believe it's the orofacial myofunctional therapy. And can you talk a little bit more about that and like what that is? And you mentioned some exercises too. Can you share more about that?
Yeah, it's really therapy that can be provided by a healthcare professional, such as a dental professional or a speech pathologist, and there may be various others. But really, the aim of myofunctional therapy is to get the muscles of the mouth, the face, lips, cheeks, tongue, throat working better, and resting better as well. So when it comes to oral rest posture, the correct oral rest posture is the tongue lightly suction to the roof of the mouth with the lips sealed gently without strain, breathing through the nose. And when we swallow, we want to have no movement of our mouth muscles. So we want to have the tongue lifting, and there shouldn't be any of this inward pull of any of our facial muscles. So oral rest posture is a big one because we actually, especially in young children, those light forces of those muscles, how we sit and breathe, they're going to have the biggest determinant of how our jaw structures grow. But in addition, myofunctional therapy is really getting the muscles to work well, doing chewing and speech and swallowing. So, yeah, it involves working with a therapist who will actually help create awareness and new habits. And then you would get some targeted exercises to do at home every day. And then, yeah, people get better at doing them, and they're actually improving their tongue function as well. And really, the tongue is so important. A lot of the time when the tongue doesn't work properly, we actually end up using other muscles, which then create more problems. So overusing the facial muscles or the neck muscles, and left untreated, these can lead to all types of headaches and problems and neck issues that I've seen and been involved in managing. However, really, when the tongue doesn't work well, and it ultimately plays out during sleep. Yeah, because that tongue is supposed to rest up in the roof of the mouth, and during the nighttime, everything is more floppy. The tongue is more prone to collapsing in the back of the throat. And so one of the earliest warning signs that this could be occurring is teeth grinding. Teeth grinding being a very common problem in children, but there is a link with obstructed breathing. So it can often be a protective mechanism to protect against obstructive sleep apnea or the prolonged pauses or blockages in breathing. So in a child with a more intact nervous system, as soon as there's an airflow limitation, there is an arousal from sleep and grinding, which actually recruits the muscles and opens up the airway. So a child doesn't get that prolonged pause in breathing, but it is an arousal from sleep, and they're not able to enter the deeper phases of sleep. It's chronic stressor. It can be linked to problems like insomnia and even anxiety. And so it's children that may have these issues rather than obstructive sleep apnea, and also thin people that may get underrecognized, but also premenopausal women, because women are largely protected from obstructive sleep apnea because of hormones. Progesterone, for instance, is an upper airway dilator muscle that helps to keep the throat open. So this is why after menopause, many women have that diagnosis of obstructive sleep apnea. They're more balanced risk, whereas earlier in that men have it, they're more prone to it or diagnosed with it.
That is so interesting. This is such good information. I love when you were talking about like proper tongue placement and, how at night when you're sleeping and how you should be breathing, it reminds me of like meditation or like when you're doing a breathing practice and they say in yoga, to where to put your tongue. And like,
Yes.
that is what I thought of because I do that when I'm awake and conscious or focusing on my breathing or doing a breathwork session. But yeah, and if you're not doing that automatically because you've got some issues going on, it's just good to know there's things that we can do about it. So I absolutely love this. This is so interesting. I hope that everybody goes out and gets your book, but would you please tell everyone where they can find you if they want to learn more about this?
Yeah, I have a new book website, breathesleepthrivebook.com. But yeah, really the book, I would say, is a culmination of a lot of time understanding the research and from different professions, from lactation consultants to speech therapists and maxillofacial surgeons that really reconstruct the airway. So really putting a lot of those different specialties and integrating them and connecting all these dots to really then go, how can I make this useful for parents? Starting from understanding the importance of sleep and what are the red flags of poor breathing during sleep, and then what are the milestones from infant feeding to as children getting older to choosing your orthodontist, and really to lay it out so it's like a guide that people can have even before their baby is born, and following it up as children get older. So I think that is a really great resource. And, my website, drshereenlim.com.au, and all my Instagram, Facebook, I'm really active on Facebook. So if they want to find out more information, those are key areas that they can.
Okay, perfect. I'll link all of that in the show notes so that it makes it easy for our listeners. Go and check out Dr. Lim. You are amazing. Thank you so much for sharing this. It's been really, really interesting. I think I have some research to do myself, and I can't wait to finish this book. It's amazing.
No, thanks so much, Jess, for the opportunity. I love to chat with people that have developed this interest, who are really passionate about sharing it with others. So I really appreciate the opportunity.
Yay, thank you. Thank you for listening to this week's episode. Please subscribe and review so we can reach more people who want to learn to glow alongside us. See you next time.